Did you know that the wrong fruit choices after age 60 could be silently accelerating your aging process? According to groundbreaking research published in the Journal of Clinical Endocrinology and Metabolism, certain fruits can dramatically increase inflammation, damage cognitive function, and spike blood sugar levels even more severely than processed sweets. A comprehensive study tracking over 1,500 adults aged 65 plus revealed something truly alarming. Those regularly consuming specific high-sugar fruits experienced a 57% higher risk of developing metabolic syndrome, a dangerous cluster of conditions that significantly increases your risk of stroke, heart disease, and diabetes. What's most concerning is that many of these fruits are widely promoted as health foods in mainstream nutrition advice. But there's excellent news, too. Recent research from Harvard Medical School has identified specific fruits that act as powerful medicine for aging bodies. These natural wonders can help reduce blood pressure, strengthen cardiovascular function, and even rejuvenate brain cells, making your brain function years younger than your chronological age. In today's comprehensive guide, we'll explore the 4 essential fruits that should become staples in your daily nutrition plan after 60. Along with 4 seemingly innocent fruits that could be silently undermining your health. Pay special attention to the final fruit on our danger list. It's widely consumed, refreshingly delicious, and beloved by millions, yet it could be quietly depleting your energy and potentially shortening your lifespan. Before we dive into these life-changing insights, we'd love to hear from you. Share your location in the comments below, and don't forget to support our mission of evidence-based health education by hitting that like button and subscribing to our channel. Now let's explore the fruits that could transform your health after 60. The Fantastic 4. Essential fruits for vibrant aging. 4. The mighty avocado. While many don't immediately think of avocados as fruit, botanically speaking, they absolutely are. And they deserve a prominent place in every senior's nutrition plan for compelling scientific reasons. For decades, conventional nutrition advice demonized all dietary fat, but modern research has completely transformed our understanding. Avocados represent one of the most beneficial foods seniors can incorporate into their diets, primarily due to their exceptional fat profile. What makes avocados truly remarkable is their concentration of monounsaturated fats, particularly oleic acid, the same heart-protective compound found in olive oil. Clinical studies have demonstrated that regular avocado consumption effectively reduces harmful LDL cholesterol while simultaneously boosting beneficial HDL cholesterol. This dual action creates a powerful protective effect for seniors concerned about cardiovascular health, as improved cholesterol ratios directly translate to reduced risk of heart attacks and strokes. But the benefits extend far beyond heart health. Many seniors aren't aware that avocados contain more potassium than bananas, approximately 975 milligrams per fruit compared to a banana's 400 milligrams. This makes avocados exceptionally valuable for blood pressure management, particularly important since hypertension affects approximately 70% of adults over 65. The abundant potassium in avocados works as a natural counterbalance to sodium intake, helping to relax blood vessel walls and naturally bring blood pressure readings into healthier ranges without additional medication. Beyond cardiovascular benefits, avocados are rich in lutein, a carotenoid antioxidant that supports eye health and slows the progression of age-related macular degeneration, the leading cause of vision loss among seniors. 3. The humble apple. The old adage, "An apple a day keeps the doctor away," has substantial scientific backing, especially for adults over 60. These crisp, delicious fruits offer a perfect combination of soluble and insoluble fiber, with special emphasis on a type called pectin that nourishes beneficial gut bacteria. A healthy microbiome forms the foundation for improved digestion, enhanced immunity, and superior nutrient absorption, 3 critical factors that become increasingly important as we age. The Journal of Nutrition published research showing that regular apple consumption significantly improved gut microbiome diversity in seniors, with corresponding improvements in immune function and reduced inflammatory markers. What truly distinguishes apples is their profound impact on cardiovascular health. The pectin fiber binds to cholesterol molecules in the digestive tract, facilitating their removal from the body and gradually reducing LDL cholesterol levels. Additionally, apples contain powerful flavonoids, like quercetin, that reduce inflammation throughout the circulatory system and improve overall cardiovascular function. For seniors managing blood sugar concerns, apples offer a surprising advantage. Despite their sweet taste, they have a relatively low glycemic load. The fiber matrix effectively slows sugar absorption into the bloodstream, preventing the dangerous spikes and crashes that can exacerbate insulin resistance or complicate type 2 diabetes management. A study in the American Journal of Clinical Nutrition found that seniors who consumed an apple before carbohydrate-heavy meals experienced 30% less blood glucose elevation compared to those who didn't. 2. The powerful pomegranate. Pomegranate might not be the first fruit that comes to mind for everyday consumption, but for adults over 60, this ruby-red marvel represents liquid gold for cardiovascular health. As we age, our arteries naturally lose elasticity, leading to reduced blood flow, increased blood pressure, and additional cardiac strain. What makes pomegranates exceptional is their rich concentration of punicalagins, potent antioxidants shown to reduce arterial oxidative stress by more than 30%, according to research published in the journal Atherosclerosis. Studies indicate these compounds may possess 3 times the antioxidant activity of red wine or green tea. Think of oxidative stress as similar to rust forming in aging pipes. It creates inflammation and narrowing of arterial walls. Punicalagins help maintain blood vessel flexibility, ensuring blood flows more freely and efficiently. Clinical research demonstrates that regular pomegranate consumption can reduce systolic blood pressure by 5 to 21% in hypertensive individuals, making it a valuable option for seniors seeking to manage blood pressure without additional medications. The benefits extend beyond heart health. Pomegranate consumption enhances cognitive function and memory retention. A groundbreaking UCLA study revealed that older adults who consumed 8 oz of pomegranate juice daily for 12 weeks demonstrated significant improvements in verbal memory tests compared to non-consumers. This is particularly valuable as memory preservation remains one of the most desired aspects of healthy aging. For seniors with dental or chewing difficulties, pomegranate juice provides many of the same benefits without requiring mastication. The forbidden 4. Fruits. Seniors should approach with caution. Having explored the fruits that can transform senior health, let's now examine 4 fruits that could potentially undermine your well-being after age 60. We begin with one that might already be a regular part of your diet. 4. Grapes. At first glance, grapes appear to be a perfect snack choice. Sweet, refreshing, and celebrated for their antioxidant content, particularly in red and purple varieties. However, for seniors, grapes present a deceptive nutritional profile that warrants caution. The primary concern lies in their exceptionally high sugar content combined with relatively low fiber. Grapes contain concentrated natural sugars, primarily glucose and fructose, and their small size and easy consumption make it simple to inadvertently consume excessive amounts. A single cup of grapes contains approximately 23 grams of sugar, roughly equivalent to the sugar content in a small candy bar. For seniors managing blood sugar issues, this presents significant challenges. Without adequate fiber to slow absorption, grape sugar enters the bloodstream rapidly, causing sharp elevations in blood glucose and insulin levels. These fluctuations aren't merely temporary discomforts. They're associated with increased inflammation, weight gain around the midsection, and elevated risk of type 2 diabetes progression. Research from the Journal of Nutrition found that adults over 65 who regularly consumed high-sugar, low-fiber fruits like grapes showed significantly higher inflammatory markers compared to those who chose higher-fiber fruits like apples or berries. This chronic inflammation can exacerbate joint pain, accelerate cognitive decline, and compromise immune function. Another concern is pesticide exposure. Conventional grapes consistently rank among the Environmental Working Group's Dirty Dozen, produce items with the highest pesticide residues. These chemical residues pose particular risks to seniors with compromised immune systems or sensitive digestion, who may be more vulnerable to their effects. 3. Dried fruits. Dried fruits, including raisins, dates, dried apricots, and prunes, present themselves as convenient, shelf-stable snack options. However, for adults over 60, these concentrated fruit products pose several significant health challenges, particularly when commercially processed with sulfites. The fundamental issue with dried fruits is their extremely concentrated sugar content. When water is removed during the drying process, what remains is essentially fruit sugar in highly concentrated form. A small handful of dried apricots contains roughly the same sugar content as several whole fresh apricots, making it remarkably easy to overconsume fructose without the fiber and water content that normally signal satiety. This sugar concentration presents particular risks for seniors managing diabetes or insulin resistance, as even small portions can trigger dramatic blood glucose elevations. Over time, this pattern can contribute to type 2 diabetes development or complicate management of existing diabetes. The consequences extend beyond blood sugar. These sugar spikes promote systemic inflammation, potentially exacerbating arthritis pain, accelerating cognitive decline, and compromising immune function. Compounding these concerns, many commercially produced dried fruits contain added sulfites, preservative chemicals used to maintain color and extend shelf life. Sulfites can trigger severe asthmatic reactions in sensitive individuals, with seniors being particularly vulnerable. Age-related changes in respiratory function, combined with higher incidence of asthma and COPD in older adults, make this population especially susceptible to adverse reactions. Approximately 1 in 100 people experience sulfite sensitivity, with this figure rising significantly among older adults with respiratory conditions. Research published in the Journal of Allergy and Clinical Immunology documented that seniors with asthma were 3 times more likely to experience adverse reactions to sulfite-containing foods compared to younger adults with similar conditions. 2. Green. Unripe. Bananas. While fully ripened bananas with brown spots can be nutritious options for many seniors, unripe or green bananas present distinct health challenges that earn them a place among our cautionary fruits for older adults. The primary concern with unripe bananas is their high content of resistant starch. Unlike the easily digestible sugars found in ripe bananas, resistant starch resists digestion in the small intestine. For seniors experiencing age-related digestive changes, including reduced digestive enzyme production and slower gut motility, this resistant starch can cause significant gastrointestinal discomfort, including bloating, gas, and abdominal pain. These digestive challenges are particularly pronounced for seniors with irritable bowel syndrome or inflammatory bowel conditions, which become increasingly prevalent with age. Research published in the American Journal of Gastroenterology documented that adults over 65 experienced more severe and prolonged digestive symptoms after consuming unripe bananas compared to younger adults. The digestive burden of unripe bananas extends beyond mere discomfort. It can potentially interfere with nutrient absorption from other foods consumed in the same meal. A significant concern for seniors who may already face nutrient deficiencies due to medication interactions, reduced appetite, or age-related changes in absorption efficiency. Additionally, the astringent compounds present in unripe bananas, which create their characteristic chalky mouthfeel, can irritate the digestive tract lining in sensitive individuals, potentially triggering inflammatory responses in the gut. A study in the Journal of Nutritional Biochemistry found that these compounds increased intestinal permeability in older adults, potentially allowing inflammatory compounds to enter the bloodstream. 1. Grapefruit. The hidden danger. Surprisingly, grapefruit tops our list of fruits seniors should approach with extreme caution. While widely celebrated as a health food and weight management aid, grapefruit poses serious, potentially life-threatening risks for seniors taking commonly prescribed medications. The danger stems from compounds called furanocoumarins, which inhibit an intestinal enzyme called CYP3A4. This enzyme plays a crucial role in metabolizing approximately 85 different medications. When inhibited, medication levels in the bloodstream can rise dramatically, essentially equivalent to taking a much larger dose than prescribed, despite consuming the correct amount. This interaction can significantly increase the risk of side effects, some of which may be serious or even life-threatening depending on the medication involved. The list of affected medications includes many commonly prescribed to seniors. Statins for cholesterol management, particularly atorvastatin, lovastatin, and simvastatin. Certain blood pressure medications, especially calcium channel blockers like nifedipine. Anti-anxiety medications like buspirone. Anti-arrhythmia drugs such as amiodarone, and even some antihistamines and immunosuppressants. To illustrate the severity, consuming grapefruit while taking the statin. Lipitor can increase the drug's concentration in your bloodstream by over 400%, dramatically increasing the risk of serious side effects like muscle breakdown and kidney damage. Research published in the Canadian Medical Association Journal documented that the number of medications with potentially serious grapefruit interactions has increased from 17 to over 85 in the past decade. What's particularly concerning is that these interactions don't require consuming large quantities of grapefruit. Even half a fruit or a small glass of juice can trigger dangerous interactions, with effects persisting for up to 72 hours after consumption. This means that simply separating medication timing from grapefruit consumption isn't sufficient to prevent interactions. There you have it, a comprehensive guide to the fruits that can enhance your health after 60 and those best approached with caution. Nutritious options like avocados, apples, pomegranates, and berries can genuinely support slower aging, sharper cognition, and improved physical resilience. Conversely, seemingly innocent choices like grapefruit, dried fruits, unripe bananas, and grapes can potentially deplete energy, destabilize blood sugar, and increase inflammation, ultimately compromising your health and quality of life. Make thoughtful fruit choices based on your individual health profile, medication regimen, and nutritional needs. When possible, pair fruits with protein or healthy fats to further stabilize blood sugar response and enhance nutrient absorption. We've shared life-changing information that could dramatically improve your health after 60, but we're curious, which of these fruit facts surprised you the most? Are you unknowingly consuming fruits that might be undermining your health? If you found this information valuable, please support our mission of providing evidence-based health education by hitting that like button and subscribing to our channel. Click the notification bell to be first to know when we release new videos on senior nutrition, including our upcoming series on the best vegetables, proteins, and healthy fats for vibrant aging.